It was a big question mark, a big unknown, but I was definitely up for the challenge. I definitely did not know what I was getting myself into back in February of 2020. I had a lot of issues with feeling inadequate. That am I giving the best that I possibly can for these patients who can't have their loved ones by the bedside. These experienced nurses were so good about letting us know that, hey, these are the sickest patients you'll ever take care of on this unit. This is not normal. It's not normal to have 20 vented patients on a 29-bed unit. So I definitely had a lot of moments of doubt, but I'm so grateful for my teammates, because if it were not for them, I don't know if I could have gone through it and continued to go through it to the degree that I have. I was just gonna give it my best shot every shift, but I think it was emotionally that was probably the biggest toll that it took. Just knowing that you were oftentimes the last person that someone's going to see before they passed away, or trying to make your patient look good so they could FaceTime with their family. I think that was probably the hardest part. I think that the nursing part and the medicine part, just as anyone does anything, over time you become more apt and more accustomed to it, but I think emotionally that was definitely the hardest, the biggest toll that it took on me. I think that that resilience, I think, is what has been the most important lesson that I've learned and I've witnessed in my community through this last year. And I think that us kind of still banding together, still as the community becomes more vaccinated, still wearing masks, still following protocols. So I think that how much we can do by working together, I think that's the biggest lesson that we've learned, and one that I hope that we continue to take with us throughout this next year. I think the last year we've been trying to give kind of all of ourselves for these patients, and then try to come back and go home at the end of your shift and fill yourself up to kind of come back and do it the next day. What I would want people to know is your healthcare workers, they have been working really, really hard. But we feel so honored to be the ones to take care of your loved ones when they're the sickest of the sick. And it's been a privilege, and it's been such an honor, but it also has been tough. So just love on your healthcare workers if you have any close to you.